You're not crazy for feeling exhausted all the time. You're not weak for struggling with anxiety or your health. Today, we're looking at a landmark research study that explains why, and more importantly, what you can do about it. This is part of my ongoing trauma series. I want to introduce you to Sue. She's a woman in her 40s. She does everything right. She exercises, she sees her doctor regularly, tries to eat well, but she keeps getting sick. Chronic fatigue, gut issues, a heart scare at 43. Her doctors find no clear cause. She starts to wonder, is this just who I am? Am I broken? But then she learns about the ACE study, and for the first time, something clicks. Sue grew up with a parent who struggled with addiction and another who had untreated depression. Her house felt unpredictable. She learned early to stay small, stay quiet, stay vigilant. Her nervous system never got the memo that she's safe now. And her body's been carrying that weight for decades. Sue's story isn't unusual. The ACE study shows us just how common this is. Researchers for that study wanted to know a couple of things. They wanted to know, does what happens in childhood actually show up in our bodies as adults? They were looking at not just mental health, but physical illness, chronic disease, even early death. So they studied over 17,000 adults in a large Kaiser Permanente health clinic in San Diego. The average age of the patients were 56. So these were people who were well into adulthood looking back. The participants were mostly middle class, employed, and insured, so they were not a high-risk population. And this matters because this is people like you, like your neighbors, like your colleagues. They studied 7 categories of adverse childhood experiences that included psychological abuse, physical abuse, sexual abuse, witnessing domestic violence against a parent, living with someone who abused substances, living with someone who was mentally ill or suicidal, or having a household member who was incarcerated. They found 6 key findings. The first one is that ACEs, adverse childhood experiences, are far more common than we think. More than 52% of participants reported at least one ACE. 1 in 4 reported 2 or more categories of exposure to adverse experiences. Finding 2 is that there's a dose-response effect, meaning that the more ACEs you have, the more health risk. They found that people with 4 or more ACEs had up to a 12 times higher risk for alcoholism, drug abuse, depression, and suicide attempts. And there was a 2 to a 4 times higher risk for serious physical illness, including heart disease, lung disease, and cancer. This isn't random. They found that it follows a clear, measurable pattern. The third finding is that ACEs cluster together. They almost never come alone. So if someone experienced one ACE, there was an 80% chance that they'd experienced at least one more. Adversity tends to stack, which is why we look at the whole picture and not just one event. The fourth finding is that coping behaviors are regulation attempts, not moral failures. So smoking, drinking, overeating, high-risk sexual behaviors. Researchers framed these things as nervous system attempts to manage overwhelming stress. From the body's perspective, a cigarette isn't a bad choice. It's a solution for dealing with unbearable feelings. So this changes how we think about self-destructive behavior. The fifth finding is that childhood adversity affects physical health, not just mental health. Things like ischemic heart disease, chronic lung disease, liver disease, skeletal fractures, they're all linked to ACE scores. The body does not separate emotional wounds from physical ones. The nervous system is the bridge between them. So, what does all of this mean? It means that your body is the record keeper of what your mind had to survive. In everyday life, this means that if ACEs are this common, it would explain why you might feel alone in your struggles, but you're not alone. The research says that half of us are carrying this. If more ACEs equals more risk, that explains why healing isn't about trying harder. Your nervous system was shaped by real cumulative stress. That's not weakness. That's physiology. And if ACEs clustered, explains why just one thing often doesn't capture your experience. Complex trauma usually means many things layered over time. And if coping behaviors are regulation attempts, it explains why you might reach for food, alcohol, screens, or even busyness when you're overwhelmed. Your nervous system is looking for relief. Any relief. If ACEs affect physical health, it explains chronic illness, fatigue, gut problems, and autoimmune conditions that doctors struggle to pin down. Your body may be living in a state of long-term stress activation, which leads to illnesses like this. Chronic stress from trauma makes sense when you know that when you find yourself in hypervigilance, where you're scanning all the time, even though you're safe, because your nervous system never got the all clear signal. Or if you find yourself in freeze or shutdown, going blank, numb, or foggy under stress. That's the body's oldest emergency brake when there's danger. Maybe you find yourself fawning, compulsively people-pleasing as a survival strategy that you learned in unpredictable environments. Or perhaps you experience collapse or exhaustion, which is the long-term cost of years of a nervous system running on high alert. High anxiety or ignoring your systems also both can be trauma responses. Hyperattunement to the body or dissociation from the body. Both of those things can come from long-term trauma. I'm not blaming you. I'm just helping you understand why these symptoms make sense. The really good news is that a high ACEs score does not equal a lifetime sentence of poor health. There are things you can do about it, even outside of deep psychotherapy to deal with trauma. It has to do with settling your nervous system first and foremost. So I want to give you 3 takeaways today. The first one is to name your state, because before you can regulate, you have to know where you are. So ask yourself, right now, am I in fight or flight, activated, anxious, or reactive? Am I in freeze, where I experience numb, fogginess, or am I shut down? Or am I in a window of tolerance where I feel present, calm, and connected? Remember, you can't think your way out of a nervous system response, but naming it does begin to shift it. I do have a free nervous system check-in quiz that helps you identify your pattern and where your nervous system needs the most support right now, and that's linked in the description below. The second takeaway I have for you today is HeartMath Coherence breathing. It's a simple 5x5 rhythmic breathing pattern. You inhale for 5 counts, you exhale for 5 counts. Place one hand on your heart and breathe as if your breath moves in and out through this heart center. Even 3 to 5 minutes can shift your heart rate variability toward coherence. And coherence is a measurable state of nervous system regulation. It's not the same as relaxation. It's nervous system regulation with physiological evidence behind it. This is one of the foundational practices in my 8-week HeartMath-informed nervous system regulation group. It's a skill that compounds over time. I'll also be making a video soon about how to improve your nervous system regulation at home with the support of HeartMath techniques if my 8-week group isn't the right step for you right now. Subscribe to the channel so you can be notified when that comes out. The third takeaway is a journaling prompt. I want to invite you to pause and write, not to reprocess trauma, but to gently witness yourself. Here's the prompt. What is one way your nervous system learned to keep you safe as a child? And where do you still notice that pattern today? Stay curious, not judgmental of yourself. You're not looking for blame. You're looking for understanding, fitting the pieces together. And I want you to remember that if this brings up strong feelings, that's important. It's a sign that maybe working with a trauma-informed therapist might help. Everything I'm sharing today is educational, rooted in research, offered with care, but not a substitute for therapy or medical advice. If this video stirred something up, if you feel activated, tearful, or unsettled, that's your nervous system responding. Please be gentle with yourself. If you're working with a trauma-informed therapist, I encourage you to bring this into your next session. If you're not yet working with someone and you're struggling, please reach out. I've put some resources in the description below. You deserve real support. If you recognized yourself in any of what we talked about today, I want to offer you a next step. Take my free nervous system check-in quiz. Takes about 5 minutes and helps you identify your dominant nervous system needs so you know where to focus your regulation work. You could take that result in with you to your next therapy session. The link's below. I also run a small, carefully held 8-week HeartMath-informed nervous system regulation group for adults healing from complex and childhood trauma. It's skills-based, not a therapy group, and it's designed to work alongside the individual therapy that you're already doing. You can join the waitlist or apply at the link below. You are not broken. Your nervous system did what it had to do, and it can learn new things. Don't give up. If you're a therapist watching this, thank you for the work that you do and for caring enough about your clients to keep learning. I offer nervous system regulation groups as adjunct support for clients who are ready to build somatic and HRV-based skills between sessions. So if you have clients working on stabilization and affect regulation, I'd love to be a resource for you. Referral information is in the description below. I also have a therapist resource list. There you'll get research summaries, nervous system tools, and group updates. You can join that at the link below as well. Together, let's offer our clients more touch points for healing. And I want to offer you nervous system support so that your healing work with your clients can be sustained. See you next week.